You know, Wyandotte County has been on a major rebound since 1997 in the unification of the government, and we've been on a tremendous growth spurt, both economically and socially. And in 2009, when we received the first Kansas Health Institute report that we were ranked last out of 105 counties in the state of Kansas, it was a major morale blow because we've been on such a positive trajectory. And I always say there's three political choices you have with bad news. You can pretend it never happened, you can shoot the messenger, or you can embrace it. And that's what Mayor Joe Reardon did. I was on the commission at the time, and we got together, myself, Joe Reardon, and two other commissioners, and formed Healthy Communities Wyandotte through a series of community conversations, grassroots, neighborhood level, and executive level. And we had a conversation with all the different stakeholders in Wyandotte County to say, here's the data, what do we do? And out of that, we formed Healthy Communities Wyandotte. And 4 years later, when I came in as mayor in 2013, I made it one of the primary focus points of my administration to look at what we can do as a community for making the health outcomes better. We organized Healthy Communities Wyandotte around initially five focus areas: access to healthy food, access to education, access to healthy infrastructure, access to education overall, and access to communication. Those areas really began the work, and since we've added tobacco cessation and working on advocacy for issues, primarily Medicaid expansion in Kansas. Those issues have really galvanized the community, and we have action teams working on all of them. We have over 100 organizations working on it, and we've leveraged over $8 million in grants, either directly to Healthy Communities Wyandotte or to the organizations working on the needs that we have. But having the government, the local government, be intimately involved in trying to improve the health outcomes has really been game-changing in terms of bringing people to the table. The mayor's office doesn't have near the power many people think we do. We don't have a magic wand to fix all the problems in our community, but we do have the power to convene. And using that power to convene, to bring people together, to think about a complicated problem and to think about long-term solutions has been transformative. And I think it's brought us to where we are now, where we're really moving the needle on a lot of the issues.